I'm Charlotte. I'm a physician assistant student here at Duquesne University. Can I please confirm your name and date of birth? All right, Mr. Bear, it's nice to meet you. So today I will be inserting a urinary catheter. That way, while you're in surgery, your bladder may relieve itself. What this requires is for me to insert a catheter through your urethra and into your bladder. So to do this, I will be inserting the catheter through your penis, and I will be making sure to keep this area as clean as possible. And whenever I do insert this catheter, it will be lubricated, but you still may feel some pressure. And as I insert it through, the pressure and pain should subside. I know I just threw a lot at you. Do you have any questions? All right. So with any procedure, there are risks for complications. The most common one being in this one is a UTI or urinary tract infection. We will do our best to keep the area as clean as possible to prevent any infection, but if you do, we will take care of it right away. Okay, so if you don't have any questions, I do have some questions for you. First, do you have any allergies to latex, iodine, adhesives, or tape? No? Okay. And then have you had any recent surgery or trauma to your pelvic area or genitalia? No? And have you ever been diagnosed with benign prostatic hypertrophy? No? Okay. So if it's okay with you, I would like to begin. And then would wash hands. Okay, so now I would wash my hands and then gather my supplies. Alright, so Mr. Bear, if you could just go ahead and lie flat on your back. And then I'm just going to place this drape underneath of you. Okay, and then can you go ahead and move your legs slightly apart? Perfect. Okay, so now I will don my non-sterile gloves. Or my sterile gloves. Okay, so now I'm going to go ahead and place this drape. So if you could just remain very still. And now I'm going to gather my supplies. So I will go ahead and dump the iodine on there. Attach my layer lock. And then go ahead and remove. And apply the lubricant. Okay, so now that I have done all of that, I'm going to go ahead and bring my materials to the patient. Alright, so I'm going to go ahead and begin my procedure, Mr. Bear, and you will, my hand will touch your thigh, and then my hand will touch your penis. Okay, so now I'm going to begin to clean the urethral meatus to the right, to the left, and then 3 times down the middle. And if this was an uncircumcised penis, I would have retracted the foreskin. Alright, so you're going to feel a little bit of pressure as I insert the catheter. I'm going till I feel resistance. And I'm noting for any urinary return. And then I'm going to go ahead and insert the water into the balloon. And go ahead and remove that immediately. And then I'm going to tug to make sure that the catheter is in place. Alright, so now I'm going to go ahead and ensure that the penis is pointed towards the umbilicus, and then tape this to the abdomen tubing, and then hang the urinary catheter on the bed, like that. So then now I will begin my patient education. Alright, Mr. Bear, I want you to go ahead and avoid touching any of the catheter, the tubing. Now, I need you to let any of us know if you feel any discomfort when you urinate, you start to develop any odor, there's any odors, pain, or you notice blood or leakage from your catheter. Okay? Now, if you could go ahead and just repeat back what I said. All right, perfect. So that is it for the catheter procedure. And, sorry. I will go ahead. Okay, go potty. Oh, sorry, my niece is right there. Lost my train of thought. So I will go ahead and dispose of all my materials. And do you have any questions or concerns? Okay, and now I will take off my gloves and wash my hands.